Over the years, I've been asked many times, what can physical therapy do for people with Parkinson's? And that's why I put this video together to help explain what things we can do to help people. So the role of physical therapy in managing Parkinson's. The intention of physical therapy is to maximize your independence and quality of life through all the stages of Parkinson's. There are three main areas that help you make the best you, the most independent. And the first one is exercise. The second one is therapy. Now there's three therapies. There's physical therapy, occupational therapy, and speech therapy. But this video is dealing with physical therapy, so we're referring to physical therapy in this video. But all of the therapies are also helpful in helping you become the best you. Then there's medications. Now, medications, they can help you move better, but they don't make you stronger and they don't make you more flexible. And that's how exercise and medications complement each other. For the remainder of this video, we're going to first talk about the physical therapy evaluation and how we take a look at walking and balance and transfers. Then we're going to take a look at the treatment aspect of physical therapy, what to expect. And that is to address conventional exercises and compensatory strategies, which are ways to help you move better, but you're using more mental activities or different parts of your brain. So what can you expect on the first day of your evaluation in physical therapy? Well, first we're going to ask you a lot of questions because we want to know what problems you're having and in what areas. Is it with walking? Is it with balance? Is it with transfers? Once we sort out your problem areas and what you really want to focus in on in therapy, then the therapist is going to get a baseline of where you're at in terms of your abilities. In addition to just checking your overall strength and flexibility, the next thing we would do is take a look at your walking. What is causing your walking problems if you are having walking problems? Is it related to your Parkinson's or is it because of something else? And the tendency is to always blame something on the Parkinson's, but that's not always the case. However, we're still going to screen you to see what's what. And if it's related to Parkinson's, it could be freezing. You could be taking shorter steps while you're walking, or sometimes your feet may be catching because you're not picking up your feet enough to clear the floor, which is not uncommon. But there's other reasons that you may have trouble with walking. And one of them could be arthritis. It could be arthritis in your back, your hip, your knee, your ankle, anywhere below your waist can cause problems with your walking. So we need to sort that out. Then also some people have peripheral neuropathy that's unrelated to Parkinson's, and it could be because of diabetes or other reasons. But there's a diminished sensation and strength in your feet and ankles, which can cause some walking problems. And then also there's weakness from inactivity. So if you're not moving around much and you're getting weaker, that can cause some difficulty with walking. Next, we look at your walking speed. What's your baseline walking speed? And then after we evaluate how fast you're walking, then we take a look and see if it matches up to similar people in your age category. We call that walking norms. So are you walking the speed that we anticipate you to walk for people your age range? Or are you walking a little bit slower relative to other people in your age range? Or maybe you're walking a bit faster, which is great. The bottom line is your walking speed enough to be functional throughout the day? The goal is to optimize your natural walking speed safely. So let's say we want your walking speed to increase, but I don't want you to think that we want you to start rushing everywhere. It should be a natural walking speed so that you're not rushing, because if people do tend to rush, then they become unsafe, and that's counterproductive to our goals in therapy. The next thing we look at in the physical therapy evaluation is what is causing your balance problems. Now, the list I have here are most relative to people with Parkinson's. There's many things that can cause balance problems, but I would say these are the main ones. So freezing of gait, I've mentioned that a couple of times, but that's where your feet are stuttering back and forth and it makes it difficult to walk. Freezing of gait is considered a fall risk, so that's important for us to address. Orthostatic hypotension, so blood pressure drops, that can cause people to fall, but that needs to be more medically managed if necessary. Otherwise, there are some things you can do conservatively to help control your blood pressure drops. And then there's impaired postural reflexes. If you feel that when you're standing, you're losing your balance backward, or if you're backing up and you're losing your balance backward as well, chances are you're having trouble with your postural reflexes regarding your balance, and that's something that we can work on in therapy. Rushing. Are you having balance problems because you're rushing? Sometimes that's more a cognitive issue where you're not really thinking about safety. You're just hurrying to do things, and you disregard the fact that you're losing balance and you continue to do something. That's a more difficult thing to treat, but sometimes just being aware of what you're doing can be helpful. And then lastly, weakness from inactivity can cause balance problems. Other than these main areas that cause balance problems, your physical therapist still has at their hands a battery of balance tests that they can perform to further guide their interventions in terms of how they can help you. And finally, the last area that the physical therapist is going to evaluate is why transfers are difficult for you in terms of getting in and out of bed, in and out of a chair, or getting up and down from the floor. And then we separate out, is it Parkinson's related, or is it because of arthritis or weakness or lack of flexibility? The weakness and the lack of flexibility can be addressed with exercise. The Parkinson's related areas are more addressed with compensatory strategies. So we've now completed the physical therapy eval, and we're going to move on to the physical therapy treatment. And there's two categories of physical therapy treatment. One is the exercise component, and then the other part is our compensatory strategies. And first, we're going to focus on the exercise component. During the evaluation, the therapist evaluated your strength and flexibility. So now they know what areas on you are weak, what's strong, what areas are tight, and which areas where you have good flexibility. There are four main types of exercise. That's strength, flexibility, agility, and endurance. And all those areas directly impact your functional abilities. For example, if you don't have strength in your legs to get up from a chair, that's going to impact your transfers. Same with stamina. If you can't walk a long distance, that's going to affect your functional walking. So working on these areas will directly impact and improve your functional areas. And in addition to further improving your functional areas, you can use compensatory strategies, which we will talk about shortly. The physical therapists, based on their findings, are going to put together a tailor-made home exercise program to fit your needs so that you can improve. And two of those components is the strength training and the flexibility exercises. I just put in two pictures here. One is an individual bringing their leg out to the side that works the hip muscles over here. And that particular muscle actually helps your balance sideways when you're walking. If you find yourself walking, you tend to veer a little bit to the left or the right. Sometimes that can be an indication that your hip muscles are weak on the outside, and this is a good exercise for that. It's a pretty common exercise that we give most individuals because this muscle group tends to get deconditioned a little bit easier. Then the other exercise is a stretching exercise for the ankle. You need good ankle flexibility to get up from a chair, to go up and down stairs, to go up hills, and for walking. So these two exercises go a long way functionally. Some people need working on their endurance, their stamina, walking longer distance at a functional speed. But This is really best done under the supervision of your physical therapist, because if you have any underlying cardiovascular problems, if you have problems with orthostatic hypotension, we need to take a look at your blood pressure and your pulse, and for some individuals, your oxygen levels, to make sure that increasing your stamina is done in a safe way without jeopardizing anything. In addition to the exercise program that your physical therapist has developed for you, there's other avenues of staying in shape, and your physical therapist may be able to guide you in Parkinson's-based exercise classes or other exercise classes that may not be specific to Parkinson's but would fit your individual needs. Another option is indoor track. You could go walking outside, but use your physical therapist as a resource to help you find avenues to exercise outside when you're finally discharged from therapy to keep you in shape. And now we're going to talk about compensatory strategies, which is simply using different parts of the brain to compensate for the areas that aren't working as well anymore due to the lack of dopamine. In other words, when this part of the brain, which is responsible for automatic movements, isn't functioning as well, that requires us to pay more attention to what we're doing because our movements aren't as automatic. And as a result, we not only have to pay more attention to the movements that we make when we're doing something and distracting, like doing more than one thing at a time, it can be more disruptive to the movements we're trying to make. Here are some examples of compensatory strategies that we use in therapy. First one is paying attention. The second one is using music. Music we use primarily for walking. And then there's movement strategies such as body mechanics and breaking down movements. And we'll go over that next. Here's one example of focusing your attention. Before you had Parkinson's, when you were carrying a casserole dish and turning to bring the casserole dish to the dinner table, you would do everything automatically. You'd be holding the dish, you'd turn your feet, and then you'd head over to the dinner table. But now, with Parkinson's, those movements aren't as automatic. So in therapy, we teach you to focus your attention not on the dish, but on the important part of what you're doing, which in this case would be your feet. Using music is another compensatory strategy to help you move better, and it's primarily used for walking. And it uses different parts of your brain to help normalize your walking. Research has shown that it can improve your step size, it can help reduce freezing, and it can improve the rhythmicity of your walking. But the therapist will help guide you what your needs are and make sure that you do things safely. This tends to be a little bit of a sensitive topic for some individuals, and I look at it from a practical perspective. If you're falling, you're getting hurt, or you're not walking much because you're scared of falling, it's just going to go in the wrong direction. So what we want to do is get walking more, do it in a safe way so that you can be more active, and then in the long run, it'll be more helpful to maintain your independence. Now, the therapist and you can help determine together what walker may be best for you. Is it the two-wheeled walker or a rollator? For some people, the two-wheeled walker is more practical, and for others, the rollator is more functional for them. So that's another way to compensate for difficulties of walking. Before Parkinson's, your body would know how to get up out of a chair. If you were sitting in a very low, deep chair, you would just naturally position yourself in such a way that you would be successful to get out of a chair. But again, with Parkinson's, these position changes are not as automatic. So they need to be more deliberate, they need to be more broken down, and pay more attention to them. And that's what we do in therapy depending on what your needs are. Everybody needs a little bit of a different tweaking to be successful. And that's the nice thing with therapy, is that all of it is very individualized, because people with Parkinson's and their symptoms are very individualized. So here in this slide, we break down the movements where you scoot forward, then you get your feet back underneath you, and then you lean forward to stand up. Now, as I said before, this was all automatic, but knowing all the steps makes you more successful. The same goes for rolling in bed. It's like you have difficulty rolling in bed, but you don't know how to automatically position your body so that you're more successful. And here's just two options to make it less difficult with rolling in bed. The one is you're reaching with your arm and your leg. And if you put more effort into those movements, if you try and exaggerate the movements, you'll be more successful. Another option is pushing with your heel in the bed and reaching with your arm. That's just another way of doing it. And in therapy, we look at all the options and then see what works best for you. People with Parkinson's tend to have an altered sense of movement. And what I mean by that is when you feel that you're moving normally, actually there is a tendency to have smaller movements. The small movements to you feel normal. Now, if you made a normal size movement, to you, it might feel exaggerated. So in therapy, we help you recalibrate your movements so you make more normal movements more naturally. So here's just one little example. Here's an individual. He's walking with a walker, and he feels that his step size is normal. So let me just play a video. So he's just passing one foot past the other, and he feels that he's walking normally. He's actually not doing too bad, but the size of his steps are a bit on the small side. So now we've talked to him about how to exaggerate his movements to normalize his walking. So he exaggerated the movements, and this is what came out. He learns how to compensate with bigger steps. So in his mind, he's exaggerating his steps, but he's normalizing his movement. And these are things that you learn in therapy. So what's an indication for going to physical therapy? Well, very simply, it's having a diagnosis with Parkinson's. The sooner you go, the better, because then you can work on prevention. If you didn't know about physical therapy, it's better late than never, because there's always something that we can help individuals with to help you function better. Optimally, it's best that you look for a physical therapist who specializes in Parkinson's, or a physical therapist who has some knowledge of Parkinson's. They just understand all the idiosyncrasies of Parkinson's so that they can help you better. So how do you find a physical therapist that specializes in Parkinson's? Well, if you have a movement disorder neurologist, they usually know a physical therapist that specializes in Parkinson's because they usually refer their patients to them. So that's a good start. And then there's Parkinson's disease organizations who might guide you into locations where there is a physical therapist that specializes in Parkinson's. And then also, if you attend support groups, Parkinson's support groups, a lot of times word by mouth is you'll hear, oh, there's a physical therapist I've been going to and they're really good and they know a lot about the Parkinson's. So that's another avenue where you can find out. So just so you know, once you go to physical therapy, we as physical therapists have a responsibility to you, and you have a responsibility to yourself. So the therapist's responsibility is to guide you on what you need to do and to help you succeed. And then it's your responsibility to do the work. And it's your responsibility to let us know what's important to you. The ultimate goal of physical therapy is to improve and maintain your mobility through self-management long-term. Why? Because the gains you make in therapy is temporary if you don't do the work afterwards. So there's a lot of hard work ahead for you, but it's very rewarding and very beneficial. In summary, the physical therapist will help you find the optimal combination of exercises and compensatory movement strategies to unlock limitations which are unique to your situation. Physical therapy can address potential problems before they become real problems. They can guide you on how to walk better. They can guide you on how to perform transfers with less difficulty. They can guide you how to improve your balance or compensate for it. They can guide caregivers how they can safely help with less strain. but any benefit will really depend on you. You've got to do the work. You need to stay active and exercise, walk regularly, and practice your compensatory and movement strategies, which will help develop your muscle memory. Thank you.